inbound travelers undergoing quarantine in designated hotels to undergo an additional nucleic acid test on the third day of arrival. At the present arrangement, these persons are required to conduct PCR tests on the 5th, 9th, and the 12th day, and we are adding an additional test on the third day. The second announcement is that starting from yesterday, the 7th of July, the government will suspend the route-specific flight suspension mechanism until further notice. I need to emphasize that in terms of the changes in the policy, especially suspension of the route-specific flight suspension mechanism, it doesn't mean that we are no longer abiding by the prevention of importation of cases policy. It is just that we want to implement the measure with precision. We also enhance testing for inbound travelers. In fact, starting from midnight 24th of May, those who arrived in Hong Kong at that time or after would be subject to additional mandatory compulsory testing on the 9th day. And starting from today, the inbound travelers will need to do another PCR test on the third day. In other words, after arriving in Hong Kong, apart from the PCR test done at the airport on the same day, they're required to take further PCR tests on the 3rd, 5th, 9th, and 12th day. And according to data analysis, during the rebound of the aftermath of the fifth wave of the epidemic, the overall number of cases in Hong Kong has reached 4 digits, and the number of new cases reached from 1,000 cases per day to 2,000 and further to 3,000 yesterday. So this is an apparent rising trend. If no improvement is made, if the situation doesn't improve, then the estimate is that the figure could be doubled in 2 weeks. But of course, the government would wish to get hold of accurate data so as to change the situation. At the same time, for inbound persons from overseas places or Taiwan, the percentage of confirmed cases accounted for around just 1 to 3%, or on average 2%. In other words, we have only 200 infected persons per 10,000 inbound travelers. So it's a matter of how we identify these 200 confirmed cases so that we can spare the quarantine requirement for the remaining 9,800. That's our major strategy now. And in fact, the daily average caseload is just about 150. That's less than 10%, or in fact, very recently, just 5% of overall caseload in Hong Kong. So we need to understand that the social cost for the flight suspension mechanism is very high. Within the past 6 months, from January to June, we triggered the flight suspension mechanism for exactly 100 times. As for cases picked up via PCR at the airport, we were able to identify 534 cases. In other words, under the route-specific flight suspension mechanism, a flight would become suspended because of 5.34 cases per flight. And with resumption of international flights, the number of passengers would inevitably go up, and this would have a significant impact on passengers if we continue to implement flight suspension mechanism. The 5.34 cases per flight would affect thousands of passengers who would have been arriving in Hong Kong in the subsequent days. Not to mention a serious bottleneck in terms of flight booking and booking for designated quarantine hotels. At the same time, we are aware of the fact that the summer holiday is coming soon, and many students would be returning to Hong Kong to go back to their families, and it is difficult for them to make holiday arrangements, which can be changed all the time. And we do welcome students returning from overseas to come back. So having considered the data and having considered the fact that the testing mechanism could effectively pick up confirmed cases from overseas to prevent them from becoming sources of transmission in the community, we have decided to cancel the route-specific flight suspension mechanism. Prevention of importation of cases is an important aspect of the government's anti-epidemic work. So the first day I assumed office, that is Monday, I immediately visited the restaurant at the airport to inspect the relevant epidemic control measures for inbound travelers without affecting our effort in preventing importation of cases. We strive to rationalize the quarantine and testing arrangements for arrivals on the basis of data as well as science, so that in terms of epidemic prevention and international connectivity, as well as allowing people to return to normalcy, we can strike the suitable balance. And I'd also like to explain the following to the public, and that is the government attaches great importance to testing. Imported cases only account for a low percentage of all cases. If we're able to have more accurate and more expedient testing regime, then at the test and hold stage at the airport, these cases should be picked up at the airport via PCR. In fact, over half of the imported cases were picked up at the airport, together with regular testing at designated quarantine hotels. Then it is possible that we can make adjustments to the quarantine arrangements subject to the testing arrangements, and we need to do so with the backing of empirical data, of course. I emphasize that for early identification and early treatment, accurate testing is a prerequisite, and the PCR test is the golden standard for COVID-19. PCR testing could allow us to identify infected persons as quickly as possible. And in order to do that, we must do it with precision so that infected persons can be isolated as quickly as possible, and that only the rather smaller number of infected persons as per the whole population can be isolated without putting on too many constraints on others. And that is why we must enhance the quantity, quality, speed, and convenience and affordability of PCR testing. That is, we must make more an accurate, speedy, easy, and cheap testing.
In terms of the capacity, in June, the PCR testing volume was around 60,000 times a day. And in July, we are going to enhance the capacity, and we have increased preliminary to around 75,000 to 88,000 tests per day. In terms of speed, we are requesting our contractors to come back with results within 24 hours. In June, around 93 to 95% of these were able to meet their standard. In July, we see that it has already been enhanced to 94 to 99%. Our target is very clear. There should be a 100% a target met for results to come out within 24 hours. Lastly, I'll have an urgent appeal for the public. The pandemic is still very severe. Now is not the time to relax. We see an increased number of cases still every day, and the medical staff are faced with huge pressure. There have been larger numbers in admitted patients and patients with severe cases. From June to today, we have seen a doubling of the number of patients admitted to hospital. Our medical staff not only has to bear the responsibility and to face high risk in taking care of COVID patients, we must prevent our medical staff, our frontline staff, from being infected because that would have a negative impact on our services. And that would also affect the normal services provided by the hospital authority. And therefore, it would also have a negative impact on non-COVID patients. Secondly, I call upon the public to be vaccinated. Inoculation can help prevent severe cases and deaths. We urge those who have not yet been vaccinated, especially the elderly, those with chronic diseases, and those immunocompromised, and children to be inoculated as soon as possible. Please do not wait to do that until the next wave arrives. Those who have been double jabbed, please take your third jab as soon as possible. The elderly and those at high risk should go for their fourth jab. I also have to remind members of the public that RAT is a method to help people know whether they have been infected in a very quickly, and it is convenient. However, rapid antigen tests have their restrictions. It is not as sensitive. For those who are tested positive with a RAT, basically, you would know that you are infected, and the public should report it to the DH as soon as possible. Even if you're tested negative, because this is less sensitive, it might be a false negative. If you have been to high-risk areas or have been in contact with high-risk people, do not think that you are not infected with a negative RAT result. You should go take a PCR test to make sure that you have not yet been infected. Thank you. Thank you, Professor Low. Dr. Trump, please. Well, yesterday we tally a total number of 2,748 cases, 1,000 out of which 1,035 of them are through PCR tests and 1,713 through RAT. There are 197 imported cases, out of which 119 through PCR tests and 78 through RAT results. Since the fifth wave, there have been 1.25246 million people infected. There are 3 deaths today reported, 2 male and 1 female, and the HA will give you an update later on. Out of all the imported reported cases, 74 of them were detected at the airport. 97 were identified while they were in quarantine hotels, and 26 of them have already returned to the community. But many of them have a high CT value, and therefore they may be repositive cases. There are a few places with over 10 cases or more, 63 from UK, 14 from Thailand, 13 from the US, 10 from Singapore. And for other places, their number is less than 10. There are 5 elderly homes that have seen one resident infected. One is 麗園會葵盛東護老安樂園 Poland Cook 仁五廉 elderly home 怡和苑怡和中心 the one in Kowloon, and there are 2 home for the disabled 富康會 and Caritas 陳振霞 Hostel. In terms of schools, 214 cases have been identified from 191 schools. Out of these 214 cases, 174 of them are students and 38 are teaching staff. They come from 37 kindergartens and daycares, 82 primary schools, 64 secondary schools, and 8 special needs schools. And in the past 7 days, there have been 107 schools which have seen 2 or more cases, and we suggest 2 schools to suspend certain classes today, including Lutheran Hiệp Thống Trung học class 4D. There are 30 students in that class, and there have been a total of 3 infected students in recent days, so we just suggest 4C to be suspended for 1 week. Lutheran 梁巨樓 Primary School, 29 students and 3 students infected, and so that class will need to be suspended for 1 week. B8.2.12.1, we have seen 20 cases today, including 18 untraceable cases and 2 which are related to other cases. A suspected B8.4 and P8.4, a total of 11 cases. 6 of them are related to other cases. 3 are untraceable currently, and 2 are close contacts. For the 3 untraceable cases, they live in Queens Road West Honlau Fong. There's a close contact that's already been unconfirmed, and Sun Lung Gok in Kowloon and Fu Wing Fa Yuen in Hoi Wing Road. There's a family member who's a close contact already confirmed. So that is all I have to report today.
Dr. Guan will have the floor. Good afternoon. There are 852 confirmed cases receiving care in the hospitals. 113 of them are new cases. For those requiring isolation facilities, 370 patients are now in isolation wards, 15 are in second-tier wards, and 272 are in North Lantau Hospital, Hong Kong Infection Control Center. 82 of them are new confirmed cases. We reported 4 patients in critical conditions and 4 in serious condition. Among the inpatients, 14 are in critical condition and 18 are in serious condition. 3 in critical condition are receiving intensive care. We also reported 3 death cases involving 2 males and 1 female with age between 64 and 85. 2 of them passed away yesterday and the other passed away the day before. They were not care home residents. 1 of them received 3 jabs. The other 2 received 2 jabs of COVID vaccines. They were chronically ill patients and they had other chronic underlying illnesses. 119 patients recovered as of yesterday, including 103 who have been discharged. And since the 5th wave, 52,623 patients have recovered, and 52,327 of them have been discharged. Since early 2020, in Hong Kong, 65,003 patients have recovered, including 64,707 of them who have been discharged. 2 patients have been identified as confirmed cases via hospital admission screening, and 3 patients sharing the same ward were regarded as close contacts. As for staff, we recorded 38 new cases. So far, 24,669 HA staff members have been infected, and 14 of them have returned to their posts. So 24,347 of them so far have returned to their positions. As for the mixed medicine ward of Alice Homebuilding Netherthal Hospital, we have 2 more cases, and so far 9 patients and 1 staff member have been infected, and all the patients are now in stable condition. In this hospital, in the male medicine ward, we picked up another case via admission screening on the 4th of July, and after contact tracing, we identified 2 more patients in the same ward being infected, and all of them are receiving treatment. They're in stable condition. The hospital is conducting contact tracing and investigation, and we have currently suspended visiting arrangements for the relevant wards, followed by a thorough cleansing and disinfection. We'll continue to monitor the staff and patients' situation, and we will continue to follow up on the situation and report to the Center for Health Protection. As for the convalescent ward of the Hong Kong Buddhist Hospital, we've identified 2 more male patients aged 56 and 73 respectively. They're in stable condition, and they've been transferred to Tung Wah groups of hospitals, Wong Tai Sin Hospital, for isolation and treatment. And so far, 14 patients and 4 staff members have been infected, and we have thoroughly disinfected and cleansed the wards, and we will continue to conduct investigation and follow up on the cases with the CHP. As for another nursing home, a 57-year-old female was transferred to the medicine ward of Port Oi Hospital because of a certain illness, and she was found to be positive upon screening. She is now in serious condition, and she's now in an isolation ward. There are 7 other patients sharing the same ward, and they are regarded as close contacts, and they will be isolated and quarantined. There is also another female staff member who has been infected. She last attended work on the 5th of July. The hospital is now conducting contact tracing to identify the source of infection. And again, for this establishment, visiting arrangement has been suspended. And some 50 staff members have been arranged to undergo testing, and the results are pending. Thank you, Dr. Kwan. The floor is open. Please use our mic when you speak, and please introduce the media outlet you represent. And please limit your questions to not more than 2. This lady in the green jacket. Good afternoon. I'm from TVB. First, a question for the Secretary. This morning, you talked about the concept of dynamic zero infection. You said many people have misunderstood the concept. They thought that we should all aim at zero infection, but the government should also strike a balance and define what zero means for Hong Kong. So what is your take, Secretary? What should zero mean to Hong Kong? What is our direction? Second, in terms of quarantine for arrivals, there would be adjustments. You consider, for example, 3+4 proposal or 7 days in home quarantine. What are the factors for your consideration? When will you draw a decision? And when is the appropriate time to make this change? Thank you for your questions. First, on the concept of dynamic zero infection, in order to achieve the so-called zero, we must try to reduce the number of cases. Otherwise, we'll be heading in the wrong direction. As for the concept of zero, let me illustrate with the example of temperature. Hong Kong uses the system of degrees Celsius. So when it comes to 0 degrees, we mean 0 degrees Celsius. But this is not an absolute figure. In fact, it's negative 273 below temperature. In other words, all the particles would be devoid of energy. They would be inactive in minus 273 K. And if we're talking about 0 degrees, it means all the economic activities and people's activities would come to a standstill. This should not be the direction for Hong Kong as an international city. We should set our own 0 degree. It's just like the concept of 0 degree Celsius. The direction, overall speaking, is to head towards reduction so that there won't be any situation in which people's lives would be threatened, in which the operation of the healthcare system would be affected, and the health of COVID-19 patients would be affected. The other balancing factor, of course, is people's day-to-day activities and also economic activities. And in this sense, we need to devise a strategy and come up with the right direction. It is beyond doubt that we're seeing an increase in the number of cases, and the infectious rate at the moment is still bigger than 1, and at one point it rose to 1.8. What it means is that one patient would transmit the disease to 1.8, and then on the following day, this would be multiplied by another 1.8. So this is totally against the direction of achieving dynamic zero infection. On the contrary, if we're able to implement a more accurate PCR testing regime so that we make it easier to identify positive cases earlier, and then we take a more stringent approach in isolating infected cases. And I must emphasize that we're isolating infected persons, and we need the community's understanding that infected persons should not be allowed to go about in the community threatening other people's lives and undermining other economic activities. So as long as we're able to identify infected cases with precision followed by stringent isolation, we should be able to cut infection. And in this sense, we can curb transmission so as to gradually reduce the transmission rate. And if it falls below 1, it means that the daily caseload will drop. Let's say if the rate is 0.9, that means for daily caseload, it will be multiplied by 0.9. And then we'll be moving towards the goal of achieving dynamic zero infection. As to what is the acceptable level, we must not allow the number of confirmed cases to further go up, and that is the goal of achieving dynamic zero infection.
As for inbound travelers, the quarantine stay currently is still 7 days. We will consider the statistics and data, and we would also assess the impact brought along by the canceling of the flight suspension mechanism. We need a clear flow in the airport, that the PCR tests taken at the airport will ensure that infected persons can be isolated as soon as possible. We see that 60% of infected persons can be detected at the airport. And the 5th day of PCR tests can also identify 95% of the import cases. If we could enhance our accuracy and to add in more tests before the 5th day, if we allow these people to return home after the 5th day, we would need to follow up because we still see positive cases after the 5th day. We must be well prepared before we make any changes to the current policy. But we are working very hard on this. We are trying to raise the capacity of PCR tests and to adopt technology to ensure that persons after leaving the quarantine hotel can still be tracked and followed up after they return home. Next question, please. The lady in black in the third row. Good afternoon from Phoenix TV. I have questions for Professor Low. Well, we see a resurgence in cases in Hong Kong. So how do you assess the risk of outbreak right now? Secondly, we see that we now new subvariants. Now from BA.2, we now see BA.4.5. Would there be actually be reinfection of cases? And thirdly, you said you hope that we'll be able to open the borders by August 4th. Do you think you'll be able to do that? Yes, this is actually an extension of the 5th wave, and we do see a rebound of cases, and actually this is reflected in the number of hospital admissions and the increasing number of infected persons. And this also reflects that since the 5th wave, the percentage of positive PCR tests after dropping in May has now resurged from 0.6% in May. We see the positive ratio of PCR tests to be 1.3%. So there has been an increase. And we have already increased the capacity of PCR tests in July. So this demonstrates a rebound of cases. Therefore, we urge the public not to relax. We must ensure our social distancing measures, don our mask properly, avoid gatherings. Because if you do not do that, those most affected would be the frontline hospital staff. We do not want to increase the cost, which means that we hope to just maintain the existing facilities, and therefore we are not going to relax any social distancing measures at this point. We must protect the public and protect our medical staff. We do not want to see the pandemic aggravating, but in order not to further tighten up social distancing measures, we need all of your cooperation. We want more accuracy in PCR tests, and I said we're trying to raise our capacity, enhance the speed and efficiency to try to go for early detection and identification. Infected persons should not leave isolation or quarantine to pose a risk on the rest of the general public. Any infected persons, regardless of staying at home or at a quarantine facility, must comply with the rules. Positive cases must comply with the law. We would apply new technology such as using a wristband to ensure that infected persons will not go out into the community to pose a risk to the rest of the people. this new subvariant is a RNA virus and it is highly transmissible. And then the transmissibility may be high, yet it may weaken at the same time. We can only assess it as it is now. Our vaccines and our tests can help us tackle the subvariants. We are going to continue to rely on our methods in early prevention to ensure that infected persons are not let out into the community. As for opening the borders, I think these are the terms I most heard since I assumed this post. I even dream about these words. However, we must have appropriate expectations. Opening the borders may mean reopening the borders with the mainland or reopening international borders. How are we to open our borders? Are we talking about returning to the convenience of pre-COVID times by using a home return permit card to just go across the border within a few minutes, or for those who work in Hong Kong yet live in Shenzhen cross the border every day? I am sure that this is not an appropriate expectation within a short period of time. The same goes for international borders. However, we will try to increase the volume. Although our measures may bring inconvenience, I hope the public will understand that we are trying to protect people's health and our medical system. We will try our best to allow more people to cross the border to the mainland or to overseas. We have done some work this past week, including communicating with the mainland to increase the number of hotel rooms for quarantine in Shenzhen and to prevent scalpers from scalpers from taking up all the hotel rooms. These hotel rooms are governed by mainland authorities. We can only communicate with them the needs of people in Hong Kong. The Shenzhen authorities has also came up with the humanity care quota arrangement, which is outside of the 2,000 quota daily. So we are working towards that direction. And as for international borders, we have already called a halt to the route-specific flight suspension mechanism and working on reducing quarantine period. So these are the ways we are trying to increase the volume of travelers.
Next question. The third row, this lady in the black jacket. I'm from Ming Pao. First, Professor Low, you mentioned that we should accept that there will be a certain level of cases. What level do you mean? Do you accept this current case level? And what is the zero degree for us or 0 Kelvin for us? Is it that the rate should be smaller than 1? And you talked about identifying the 200 cases with precision so that the remaining cases wouldn't have to go under quarantine. Is there a target? For example, within 3 days, you should be able to identify a certain percentage so that we can shorten the quarantine period to 3 days. Another question, we've received inquiries from some hostels, and some residents were released from hospital, and after being sent to the residential care homes, they tested positive again, so on and so forth. I'd like to ask Dr. Zhang how these cases would be handled, and also Dr. Kwan, what are the criteria for discharging patients living in residential care homes? Would they be discharged back to the care homes or otherwise? And also, I'd like to know the new term of government's thinking on those living in residential care homes to prevent the same serious situation from occurring again, like what happened in the 5th wave. I'll defer to Professor Chong to answer the first question. We need to be clear what our goal is. What we're sure that is that in terms of direction, we need to reduce the number of cases. The rise in the number of cases would pose an adverse impact on our healthcare system. The COVID-19 epidemic has been around for 2 years, and for dine-in ban or lockdowns, I think we all understand that we should avoid implementing these measures as much as possible. So what we need to do is to identify infected cases, because for dine-in ban and lockdown measures, the reason these measures were needed were because we could not identify infected persons, and that everybody should just stay in and prevent further spreading of the virus. And according to the chief executive, we should identify and pick up sick and infected persons and put them in isolation instead of putting everyone else in isolation. And that is why we need to regularize PCR testing. It is an effective means to identify infected cases so as to prevent them from spreading the virus in the community. This is the only means to reducing the number of cases. Normalizing PCR testing is also one important means in our country's anti-epidemic strategy. They have a 15-minute testing circle. The direction, all in all, is to regularize or normalize PCR testing so that we stand ready in identifying infected persons. We need to be prepared so that when it strikes us, we'll be able to identify infections by PCR testing. Instead of introducing lockdowns and bans whenever the next wave hits us, we should be able to identify infected persons anytime, anywhere, and prevent spreading of the virus in the community. Second question about the number of days one should spend in a quarantine hotel. I'm afraid I can't tell you the exact number of days at the moment. I understand that this is an issue close to everybody's heart, but this term of government is all about science and data. We need to let the data speak. We need to find out which anti-epidemic measure would cause the least with the greatest effect. And time is needed. Say, I'm a doctor by profession, and when I treat a patient, I take the same consideration. We have different treatment plans and drugs available, but we need to consider the drug's efficacy and the side effects. Let's say if I prescribe a drug that entails side effects far outweighing the efficacy, then I would stop this medication. And let's say if I prescribe a course of 5 days of medication with the same effect of 7 days, then we may opt for 5 days, the 5-day course. Now, I'm not suggesting that the quarantine hotel period should be shortened to 5 days. I'm just using a course of medication as an analogy. Say if we have double-blind comparative clinical trials, we compare the result of a 5-day course and a 7-day course, or even a 3-day course before drawing a conclusion. So without data backing, we will not arbitrarily make any change. Dr. Zhang? I guess your question refers to a confirmed case being a residential care patient after being discharged is found to be positive again. And this is no surprise because after you've been recently infected, if you go back to a residential care home in which you have regular testing, it may be possible that these cases with high CT values may be picked up. But it does not mean that these cases are highly transmissible because they have high CT value. Dr. Guan, for elderly residents in care homes, if their condition is stable, we'll allow them to go back to the residential care home. On the 7th day after onset, we'll conduct an RAT test. If the test result is negative, they can be discharged to further observe isolation in their residential care homes. If they're in stable condition, they will be referred to holding center for elderly residents in the community until they get a negative test result. And when this happens, they can be released back to the residential care homes. We're now considering stepping up testing for these residents, including PCR testing. Let me supplement. One emphasis for hospitals is that we need to ensure staff as well as patients in hospitals would not be subject to major outbreaks. They need to be protected. We have isolation measures to prevent outbreaks. So it is important to have PCR testing in a more precise manner. And in the future, we're going to step up PCR testing at hospitals and care homes to make sure that the virus would not enter these establishments. They should be away from these establishments so that we can protect our elderly.
Okay. 嗰邊第4行
The 4th row, this lady.
I have 3 questions from ViuTV News. The first question, just now you mentioned a more precise testing strategy will be deployed. Does that mean you will refrain from imposing indiscriminate social distancing measures like banning dine-in or lockdown? And under what conditions would you resort to imposing blanket bans? And the second question, as cases are expected to double in 2 weeks, does Health Bureau has any response plan to prevent public hospitals from being overstretched? Could the authorities promise that the collapse of healthcare system will not happen again? And the third question, you once said living with the virus will get us all killed, but Hong Kong has been failing to maintain zero COVID. How will you close the gap between the goal and reality? And do you have any concrete indicators or KPI to measure the easing of pandemic and the performance of the government? Thank you.
Can you repeat your first question? There's one word I missed.
Just now you mentioned a more precise testing strategy would be used. And does that mean you will refrain? That means you would choose not to impose some indiscriminate, like a blanket ban of the social distancing measures? Thank you.
Yes, this is the direction of the government. We will try to exercise our maximum responsibility in order to try to improve the current detection test measures, such as making our PCR tests much more easily available, cheaper, faster, and more convenient for our patients, for our people. And in that case, then we can detect and isolate those infected minority rather than imposing all these more strict social distancing measures to the non-infected majority. And this is the way that we are moving forward. And your second question is about the current trend that the number of infected new cases is now, well, roughly doubling in about 2 weeks' time. Yes, this is the prediction based on the trend in the last few weeks. But I think we are here to shape the future. We will have to carry out more vigilant and more precise testing and more vigilant isolation for all those infected minority, using including home isolation and also specific isolation facilities to make sure that those infected people are not walking around in our community and causing community outbreaks. I think with better detection measure and isolation measure, we will be able to reduce the community transmission and reducing the R0, hopefully to below 1. And then we will be seeing a decrease in the total number of cases, new cases every day. And finally, about whether COVID is a deadly disease. Now, well, you can ask the over 9,000 people who have died within the last 3 months in the 5th wave of pandemic. It is a disease which can kill. And remember, even in SARS, we have SARS for 6 months, and there are 299 mortality, compared to our 5th wave of COVID, which caused over 9,000 deaths within 3 months. Even though we say that COVID is less virulent than the SARS, but the fact that it's so infectious, it's so contagious, it actually killed more patients than SARS. So I would definitely sustain my statement that, COVID is not a mild disease, and we cannot just lie flat and coexist with the virus. The virus will attack us. And in fact, it may not be the younger people, the more well-off people. It's our underprivileged people, the elderly, the very young, and our chronically ill patients. And we have, as the government, we have the duty to protect them.
下一位，呢邊第三行。
Next question, please. The gentleman over there. Good afternoon from St. Paul. The secretary said there will be an additional day of PCR test so that it will be more accurate. We see that we are able to detect 95% of the cases, but the remaining 5% actually may go flow into the community. Under the new policy, are you confident that you'll be able to prevent more cases for going into the community? Quarantine people hope to be able to return home after 5 days. So are you going to consider the 5+2 hotel plus home quarantine arrangement? When would you actually roll this out? I'd like to ask about GBA doctors coming over to work in Hong Kong. As we see from the news yesterday, in October, the first batch of mainland doctors will arrive. Why do you need to launch this program so soon? Do you expect that the overseas doctors' mainland arrangement is not enough? So would the mainland doctors be working hands-on or working in consultant work? Would you consider introducing more mainland doctors? You've already asked 2 questions. How about we take these questions first? Secretary, please take these 2 questions. Well, I don't think talking about overseas doctors is an appropriate discussion today, because if we start off with this topic, I'm sure we'll have to stay here for a very long time. Well, let me address the question regarding new quarantine arrangements. First of all, we haven't come to a decision yet. I haven't mentioned 5 days or 2 days. We are trying to optimize the current policy. Let's say there are around 10,000 inbound travelers each day. Well, actually, we haven't reached this number, but let's say the number is 10,000. 1%, let's say I use 100 as the number, 1%. Well, 100 of them may be infected. At the airport, we are able to detect 60 infected persons through PCR tests. For the remaining 40, we would identify 35 of them through the 5th day PCR test. And you are correct. You can say that, oh, there may still be 5. Assuming they leave hotel quarantine early, they would be in the community. But then you have to understand that on the 6th and 7th day, inbound travelers do not take PCR tests. They only take RATs. Actually, we'll have to wait till the 9th day, which is when they take another PCR test, that we would detect them. So these 5 could only be detected on the 9th day. So this is an improvement we could make to conduct another PCR test a bit earlier. If we are to detect all cases at the hotel, then I can tell you that it's very difficult, because we would only detect some of them after the 20th day. So if we are to find all out of these 10,000 people, then they would need to stay in the hotel for 20 to 30 days for us to pick out each and every infected person. That is not cost effective at all. We would not pursue this sort of accuracy of 100%. 90% is already a very high accuracy. We are not just letting these persons leave after hotel quarantine on the 5th or 7th day. We would use technology such as using wristband to monitor them, and they need to comply with our regulations, followed by more PCR tests. We are thinking of an additional PCR test either on the 7th or 10th day to identify the remaining 5 infected persons to prevent outbreak in the community. There are many silent transmission chains in the community now, which is why we see 2,000 to 3,000 cases a day. There are ways in which to track down these persons, but that number itself is not does not have a very high impact. Last question, please.
From RTHK. So the government has lifted the flight ban, but this may lead to a bottleneck in the quarantine hotel booking. So how likely relaxing hotel quarantine is the next step forward, and on what conditions will you adjust the measures? Thank you.
I think relieving the flight ban is not just about increasing the number of people coming back, travelers coming back. It's a measure to relieve the stress and the uncertainty of all those who are planning to return to Hong Kong, especially during the summertime when we have all our youngsters and students they have the summer vacation, and that is the only time they can come back to reunite with the family members. It's important for us to take care of them. And that's why we've chosen this time to relieve the flight ban, because a few infected people on the flight causes disruption of the travel plan of thousands of passengers. And this is something which is very costly for the whole society and our travel industry. At the same time, it doesn't really contribute much to our overall measure in controlling the COVID.
好，今日記者會完。
That's the end of today's press briefing. Thank you.